Alright, I have performed hand hygiene, verified my physician's orders. We have an order for trach care. Now I need to identify my patient and explain the procedure. So, can you please state your name and date of birth? Good. Ms. Smith, today we'll be doing trach care. I'm going to suction out your trach so that you can breathe a little bit better. And I've explained the procedure, so now I'm ready to set up my supplies. While I'm setting my supplies up, I'm being sure to hyperoxygenate my patient for at least 30 seconds. The wall suction needs to be set on 120 to 150 millimeters of mercury for an adult. For a child, it would be per hospital policy. So, making sure that my suction catheter kit is in date, and it is. So, throwing all that out. Now ready to set up, I'm going to touch the outer side here of my box to prevent contamination. Whipping my normal saline into the trash and pouring it in here. And now I'm going to put on my sterile gloves. Touching only the outer length of my glove. Alright, this is all sterile here, so I can touch. I'm wrapping my catheter in the non-dominant hand. And I am going to use my dirty hand to attach it to the suction. So it's attached now. And I'm going to test. And it came off, but in real life it would be together. So we're checking the suction. We're going to remove our mask and draw in until we meet resistance or until the patient coughs. My patient has coughed, so now we'll suction intermediately until out, and we'll hyperoxygenate after. So we'll clear this, clear our secretions, and do that as needed. Now that we're through, we'll dispose of all of our supplies, perform hand hygiene, and now we're going to perform trach care, cleaning the trach. So I'm going to explain, I've already identified, I've reviewed the orders. We do have an order to clean. Ms. Smith, verifying the name and date of birth. Good. We're going to clean out your trach now after we've suctioned. So, I'm going to go ahead and set this right here. And I can touch the inner, there's a 1-inch border that I can touch to get this out. Being sure to only touch the 1-inch border. Putting the shiny side down. And now I'm going to dump everything out. Okay, so we've got that. Now I'm going to do normal saline, and we're going to pretend that this is hydrogen peroxide. We're lipping both of them. In our largest compartment, we're doing half saline, half peroxide. In our other two compartments, we're doing saline, sterile normal saline. And for our trach care, we're sure to have our hemostats at the bedside. So now I need to put on my gloves. And here they are right here. Being sure to only touch the outer cuff. Need to put them on the right way. And I can touch my whole glove now that I have this one on. Outer cuff, that's all I'm touching. Alright, so we've got that on. Now I'm going to take my non-dominant hand and remove the trach out of this. So I'm removing, and I'm twisting it here to take it out. And I'm placing it in my mixture. I'm going to take this brush and I'm cleaning the inside. I can only touch the outer portion. There we go. Getting all the nasty stuff off of it. And I'm rinsing it in my normal saline. And this is Trach. So this hand is still clean, so I can grab off of here. I'm going to dry the inside with my pipe cleaners, Trach. And this is my good gauze for my dressing, so I need to save it. And I'll dry the outside here, like that, Trach. And now we're ready to go back in, being sure not to touch, and it locks back in place. So with this dirty hand, I'm going to remove our soil dressing, put that in the trash, and we're going to take this, put it in our saline that we haven't used, and clean around on the wound. And I'm pretty sure that I just contaminated my field, so I would just start over. Clean in here, Trach, and that's it. Now we're ready to place our new dressing. And our patient does have trach ties on. So I'm going to place it and I'm going to use my hemostats to pull it through. Alright, so now that that's placed, we're ready to do our trach ties. And our patient does have trach ties on. We would be sure and leave the old trach ties on until we get new ties on. Alright, and as we're doing these, we're going to be sure to leave I can put 2 finger widths between my patient's ties. So we've got 2 fingers here. I'm going to just use my hemostats to help put it in here. I want to be sure that it's not too tight. We've got 2 finger widths apart. Sorry, Miss Smith, I'm all in your face. Alright, and we'll cut the excess dressing. Make sure our patient's in a comfortable position. Call bell within reach, bed in the lowest position, and we'll document.